Hi, I'm Dr. R. Santosh. I'm a consultant endocrinologist from the Magna Centers for Obesity, Diabetes and Endocrinology, Nagar branch in Hyderabad. Today, we've come to discuss about the important condition known as PCOS, something that strikes terror in the hearts of many of young women. Now, what is PCOS? The full form of PCOS is Polycystic Ovarian Syndrome. It's a little different from the Polycystic Ovarian Disease. Polycystic ovarian disease means there are cysts in the ultrasound, and it may often tell us that it is an advanced stage of the illness rather than an early illness. But PCOS can occur in young girls also. It can occur in 13 years age, 14 years age, 15 years age without actually looking at cysts in the ultrasound. How do people present with PCOS in young age? They present with unwanted hair growth, they present with acne, they present with hair fall, and they may present with irregular periods as well. As the spectrum of PCOS is going on in the age of a person, they slowly start developing a lot of problems related to the periods, which are usually delayed periods and heavy periods. And as we all know, if PCOS is left untreated, it may lead to the really unfortunate outcome, that is infertility. So instead of trying to scare people, let's try to understand what is the root cause of PCOS, because if we understand what the root cause of PCOS is, you might actually avoid it in the future. So Polycystic Ovarian Syndrome occurs because of a condition called as insulin resistant state. Insulin resistant state is something that builds up from the childhood of a girl, and even for a boy for that matter. Boy will not have PCOS of course, but it occurs mainly from the childhood itself. Insulin resistance occurs in which group of people? It occurs in one, if there is a family history of diabetes, you have to be aware that your child might be at increased risk for insulin resistance. 2, lack of exercise. Now, lack of exercise is a very important contributing cause to the development of PCOS. 3, irregular eating habits, eating less during the daytime, eating more in the PM time, in the after evening. If you start eating a lot of time, if you eat very less during 5 days and suddenly you eat a lot during the weekends, it also causes insulin resistance. And last but not the least is mental stress. The mental stress associated with studies, the mental stress associated with job, the mental stress associated with peer pressure on Facebook, Instagram, whatnot. There are so much undue mental stress that children and young girls are now facing. What is insulin resistance? Insulin resistance is a condition where the body is producing insulin, but that insulin is not able to act properly. Now, for example, if you want to control the blood sugar of one particular person, everybody requires around this much insulin. Now, in those people with insulin resistance, this much insulin is not enough for them. They will end up producing this much insulin, and the sugar will be normal only. So we are not talking about diabetes, okay? Insulin is high, sugar is normal. But this excess insulin which is being produced in the body to control the blood sugar has 3 important effects in a young girl. Number 1, it causes pigmentation or darkening of the skin wherever the skin is folding over. So if your child is having darkening of the skin around the neck, in the knuckle area, in the elbows and underarms area, it is a sign for insulin resistance, and this girl might be at increased risk for developing PCOD in the near future. The second thing that excess insulin does is cause weight gain in the tummy area. So if your young girl is putting on a lot of weight in the tummy area, it is a sign of insulin resistance which can predict PCOS in the near future. The third most important thing that occurs because of excess insulin is that insulin goes and acts on the ovaries. It actually acts in different parts of the reproductive axis, but just for clarity, we'll imagine that insulin is going and hitting the ovaries continuously. That excess insulin that is there in the body is the one that is causing those small cysts that are visible in ultrasound after some time. Now, because there are cysts on the ultrasound, the hormones imbalance from the ovary is very much pronounced. There are 2 things that happen. There is increased in the female hormone estrogen in such a way that a girl's body sexual parts will be developed very well, but she'll start developing excessive bleeding, delayed periods, etc., etc. The male hormones, testosterone, also increases slightly in women, which is enough to cause unwanted hair growth, pimples and hair fall. So if you go to any doctor, let's suppose you go to gynecologist for irregular periods, they will like to give you some pills which will regularize the periods. You go to a dermatologist, they would like to give you some cosmetic procedures or some medicines which will help to reduce the unwanted hair growth, hair fall. You go to an infertility specialist, they'll treat the infertility. But unless you treat the root cause of PCOS, nothing is going to happen. It's easy to prevent PCOS and treat PCOS if we treat the root cause properly. And what are the three main things that we do? Number one, in diet counseling seems to be the most important part of PCOS. If you regulate your diet properly, then the amount of spikes of insulin that are occurring throughout the day will be much lesser. A dietitian who's well trained in the subject of insulin resistance needs to handle your case. So she will give you one particular diet which needs to be followed throughout the day in such a way that insulin resistance gets controlled well. The second most important thing that we do in insulin resistance is pranayam. So pranayam will help us to reduce the underlying mental stress. It will help us to concentrate in our studies better. It will help us to do well in our job, but it will also reduce the insulin resistance and bring down the PCOS. And the third most important thing that we do is exercise regularly. What is regular exercise? Regular exercise is defined as at least 3 hours of regular aerobic activity. Aerobic activity means walking, running, cycling, swimming, cross trainer, treadmill. If you are able to do at least 3 hours of aerobic activity, what's going to happen is the blood flow to the muscles will improve and lot of glucose will be taken up by the muscles directly without the requirement of that insulin spike that is occurring throughout the day. So remember, whatever treatment for PCOD you are, whether you are on hormonal treatment for your periods, whether you are on other medications for your cosmetic treatment, whether you are fertility induction for fertility, if you don't treat the root cause of PCOD, you are not going to have much success on that. So diet, exercise, pranayam, meeting an endocrinologist who may or may not have to give you treatment for insulin resistance, but at least will show you the right pathway is very important in the management of PCOS. I think with that, I rest my case today. Instead of going too much into the technical jargon, I think I will stop here. Thank you for the patient listening.